Welcome back to Philippines Uncut. I'm Buddy Kunanan. Tonight's topic is acupuncture and Chinese medicine. And joining us still is Dr. Philip Nino Tangatue, Clinical Associate Professor, UP College of Medicine. Doctor, welcome back to our third and final segment.
Thank
now,
you.
before we start, I want to go back to that video we showed earlier where you have this guy walking into this little inky clinic with 100, maybe 500 needles. Clinic, quote unquote, in China, somewhere in China. So what can people expect? I mean, a lot of people like me, for instance, we have a natural phobia to anything pointed, needles especially.
Oh, I don't blame you. In fact, in my blog, I titled that under the biggest lie in the history of medicine, which is when we're kids, kagat lang to ng langgam.
Oh, baka langgam na ganyan kalaki. Di ba?
Well, that's exactly. Ano yan?
Langgam.
Oh, ano yan? Langgam o aso or something. So, the difference is, and I'm going to show this right now, most of the syringes we're used to are thicker. They're hollow, so they are beveled. They have multiple edges in the dulo. An acupuncture needle, as you can see, I don't know if the camera can see this.
Hold it steady first, so the camera can zoom in. I think it's very small. It's like a strand of hair.
And you can see it's almost like a guitar string.
Wow.
And then if you don't know how to do it properly, let's do it the other way so you can see it more. It actually bends if you don't know how to insert it properly.
So it's very pliable. It's very fine. Is this smaller than a gauge? I don't know the gauges.
There are different gauges, actually.
Yeah.
You can have one that's actually like 0.5 millimeter thick, some very thin.
Is this the thinnest one?
This one that I'm using now is actually 0.25 millimeter thick.
Now, would that be
There
thin
are
or
thinner
thick?
ones.
Oh.
This is like just right.
Oh.
Like, this is the baby bears needle. The papa bears can be thicker. So I'm using a new needle. Factory sterilized.
Before we go to that, let's talk about a typical session. Let's say someone walks into your clinic. What happens? I mean, are there any, do you have to prep the patient first before they
Well, of course,
this thing?
I have to give, before anything else, we have to know what the problem is so we can plan a strategy on how to do it. See, I've been reading too much Zhang Jingyue. Zhang Jingyue is an ancient Chinese doctor, former soldier, so he speaks in terms of military tactics. First is know your enemy. So a lot has been said about Chinese doctors being able to diagnose just by feeling the pulse.
Pulse, looking at your tongue.
And
do you do that?
That's essential, actually. Why? Because in Oriental medicine, in Chinese medicine, we're not just treating a headache. We're trying to see what's going on behind the scenes leading to that headache. So the tongue may not necessarily tell us it's a headache, but it tells us, oh, the tongue color is pale, so maybe the blood is kind of iffy.
Parang holistic approach, really, no?
Just like in Western medicine, sometimes one lab test won't tell you everything, but a constellation of different findings will give you your diagnosis.
But for Chinese medicine, for instance, is it really possible just by looking at someone's tongue,
the ancient texts idealized doctors as being able to diagnose just by looking at the patient. So the legendary, and I emphasize legendary, Chinese doctors are supposed to be able to do this. Just this morning, I correctly predicted a lady's menstrual cycle being too short just by looking at her lips. So I'm getting there.
Wow.
But it's the same as Western medicine. Sometimes a patient comes in, from the way they walk, oh my God, this is appendicitis.
No, but I mean, that's obvious because, I mean, there's pain really involved.
No, but not necessarily. No? Sometimes they just walk a different way.
What about the nails, doc? I've heard also that in Chinese medicine,
basically we're supposed to look at everything.
Okay.
So we're supposed to take note about the volume of your voice.
Wow.
Feeling the meridians to see if there are any points that are kind of more sensitive or more taut than others. That's kind of how it works. Sometimes, though, a case comes in where the Western diagnosis is already there and you don't really need to do much.
How long is a session of acupuncture?
That also depends on the style and the particular style of the practitioner. For me, it's about half an hour to 45 minutes, depending on what we're trying to do.
Now, how come a lot of people, I mean, there's some practitioners, I know for a fact that some put in 50 to 100. How many do you usually put in?
Personally, I try to keep it down to a minimum.
That's nice. I like that. Minimum needles.
In PGH, I'm known as 4 needles or less, or 3 needles or less.
Wow.
But that's because of the style I practice. I try to use what we call the 8 extraordinary vessels, which usually just 2 needles, one on the hand, one on the foot, the coupling points.
What is the logic behind that? Less needles? Because in pop culture, we see, you know,
Oh, like
again,
that, like that
yeah,
commercial.
like that. I mean that obviously is an exaggeration, but you know, we see people in pictures of images.
I'll try to explain that with Chinese herbology.
Okay.
I noticed that the early Chinese herbal formulas, like circa 200 AD to 800 AD, they'd use only like 4 or 5 ingredients, but higher dose. While the later formulas, and most Chinese doctors now, they might use 20 ingredients but lower doses of each.
Yeah.
So I think we're trying to cover more bases. So I think that's the same thing here. And I've observed, it's just me personally, others may disagree with me, and that's okay, kasi kanya-kanyang style naman yan. Less needles, the effect is stronger on each needle.
What about the points? I mean, you put them in specific points, right? You don't just put them anywhere. I mean, there are specific points.
There are specific points, and then you don't. Here's the one misconception. Okay, I'd like to clarify this here and now. Some scientific studies say that acupuncture is not valid because putting a needle on a predefined WHO-defined acupuncture point seems to have only slightly better effect than putting it on a random spot on the skin. So skeptics will say, ha, fake, utterly forgetting that these same studies also say putting a needle anywhere better than not putting a needle anywhere at all. And in Chinese medical theory, that's valid. You can actually put a needle anywhere and expect an effect. Kaya lang minap yung points because they have greater effect.
For optimum effect.
Precisely.
Well, yeah.
It's just like saying, why do people go through main roads? Because they're wider and they have greater access to more
quicker,
more destinations. Dadaan ka sa eskinita, hanggang dun lang.
Yes. Now, another question on most people's minds, is it painful? Is this thing?
Okay, I'm going to give a speech which I give to new patients. So people in my clinic, they've heard this so many times, and I've said this. Most of the time, when people ask, is it painful, they're afraid of pain on insertion.
Yeah.
And that's a valid question given our experiences with needles. I can say that for most cases, it's not painful. And there are exceptions, some points where no matter what they hurt, but I usually tell them beforehand. And they're prepared naman. It's like, okay, that's not so bad. Now, the question is, does no pain on insertion equate to I won't feel anything?
Yeah.
So there are some patients na they think that they're not going to feel anything, and then when they feel something not painful, they're like, akala ko ba wala akong mararamdaman? So disappointment sets in, and the patient-doctor relationship is already tarnished.
Yeah.
So I explained that you can feel something. In fact, you're supposed to feel something.
Because you're supposed to stimulate something, no?
Yes, that's why the definition in the video earlier was stimulate.
Okay.
Now, how does this feel like? The science nga says that it's specific, the A-delta slow fibers of the nerve, because nerves are like wires.
Okay.
Lots of specific fibers inside the wire. It's not just one homogeneous transmitting everything. So, and each of these cables inside the bigger cable transmit something specific. Okay. So what is specifically induced is the stimulation for what codes for heavy or electric. They have a term for it in Chinese, swan, or in local dialect, sung.
Okay.
It's hard to translate, but it can be described as distending, heavy, electric. I compare it to when you hit your elbow, diba, minsan may ground.
Like that, yeah.
Something like that, but a little more controlled.
Okay. Which is, okay.
So like right now,
yes.
I've previously already sterilized the skin.
Okay, wait.
So
okay, wait.
focus
So,
on this.
what do you want me to do?
Just relax.
Okay,
and
just
talk.
relax. Do you want me to put my arm here on?
No, I'm cool. I just want the...
Can we zoom?
See, so I'm taking the needle,
wait.
and I'm not cheating, no guide tubes.
Wait, no guide tubes?
Yep, because look,
Why don't you have a guide tube?
because I don't need it.
Oh, okay.
Did that hurt?
No, not really. But I did feel some sort of like
that
a little,
heaviness.
Yeah, and a kind of
See?
like a...
Like an electric
Yeah,
thing.
like a little charge.
See, that's the point there, if you'll pardon the pun. That's the point. I explained it to you, that this is what to expect. Therefore, the whole experience becomes totally pleasant and acceptable.
Yes,
if you were not expecting that charge, it'll be like, ano to?
Yeah.
So, see? But the point is, it's not supposed to feel sharp.
What is a guide tube, you said? I mean,
yes.
And why the need for a guide tube?
The Japanese invented this, one of the great inventions of Japan.
Okay.
I'll take the guide tube out of this pack. This is a pack of Korean needles, by the way.
So there's Korean needles.
Japanese needles.
Japanese needles, okay.
In fact, a German company once contacted me. You can move your arm now,
okay,
any way you
right,
want.
Here we go. Okay.
You can actually move it.
Oh, yeah,
see?
Yeah, see, it's moving.
So you notice that the guide tube, it's meant to be, so you can see that the length of the tube, the length of the tube is only slightly shorter than the needle. So the idea is you're supposed to tap it very quick, and then the needle is inserted.
Oh, so it's like it's exact. The amount of needle going to your skin will be like exactly.
Except I didn't need it. Now I want to show you. Remember what I was saying about acupuncture needles making the blood flow better? You can see that it's becoming red around the needle.
Yeah, I can see it. Sure. Okay. Yeah, it is kind of like getting red with some, around that point.
It's a controlled inflammation because no matter what, this is still an invasive procedure. That's why
your body is going to react.
Yeah, of course, I'm puncturing the skin.
Yeah.
As with any other invasive procedure, there's always a risk for infection and everything, but very minimal given these are factory sterilized single-use disposable.
And we did put alcohol prior to going on to sterilize.
And I washed my hands also. So
okay. Now, Doc, let's talk about, we have a few minutes to close. Let's talk about your plans for the future.
Well, like I said, this is still an invasive procedure. So we'd like to set and maintain high standards for this profession. It's not yet legally a profession. There's no licensure exam under the Professional Regulation Commission. But my personal dream is that someday acupuncture and herbal medicine are not just isolated modalities under one blanket system, but the whole system is recognized as a profession under the PRC, complete with police power, complete with
to put some regulation,
a board regulation.
Yeah. Because we've noticed now that a lot of practitioners really, and then they have diplomas from here, from there, from Taiwan, from China, and people like me who would like to go and see an acupuncture practitioner. Sometimes we don't know. And the problem, where to go.
The problem there is also from country to country there are different standards. For example, in the United States, licensure there for acupuncturists began in California. So the title there is LAC, licensed acupuncturist. So they're licensed to practice in California and certain other states. In Hawaii, the title is different.
Okay.
In New York, you have to take a different exam. I could be wrong. I'll have to check with my friends.
Now, Doc,
in Canada, it's different.
Yes.
Your title is certified acupuncturist, if I'm not mistaken. You are certified to practice acupuncture only, but if you complete a module in herbal medicine, then you can be called a herbalist. If you can complete all the modules, you're an oriental medicine doctor. So here in the Philippines, we have that certification for acupuncture. In Indonesia, they have acupuncture and herbal medicine separate. But here in the Philippines, none yet for herbal medicine. That's one of the things I want to get the ball rolling.
Very nice. Doc, before we go, maybe you would like to give your details, say something to the audience, and people would like to look for you now, and if you've seen you on TV and heard this very nice discussion of ours.
I'm glad you liked it.
I liked it very much.
So, as mentioned before, I'm Dr. Philip Tangatwe. I'm from the UP College of Medicine. Easiest way to find me would be to just search for my name. You can see the details right below on your screen. You should see either my Facebook page where people like to post questions. I try my best to answer. I also have a blog, which I try to blog about twice a month. It's called acupuncture.net.ph. There's a .com.ph that belongs to my good friend. You can visit that also.
Thank you very much.
But .net.ph is the one that I write. There are links there to some articles that I've written, some videos that I've, I didn't make them. People actually videotape me while lecturing. So,
and this show will be on YouTube soon, so you can also upload this so people can watch this again and again.
Oh, thank you. Now I have a topic for a blog entry.
Excellent, excellent. Dr. Tangatwe, thank you very much for coming to the show, and
thank you for
been
inviting
very
me.
enlightening. As I said, I've done a lot of shows on alternative medicine, but I learned so much now with you here. It really opened up a lot of new avenues of thought for me. Thank you very much.
Thank you very much.
More power to you, sir.
Yeah.
All right. I would shake your hand, but I still got this needle in here, so I'm going to do
fist bump.
Fist bump. Fist bump. Right. So,
let's take that out now.
Wait. No. All right. Sure.
I want to show the audience that there's just a
little charge going on there, but okay. So, guys, thank you for joining us here on Philippines Uncut. Join us again next week where we talk about matters to you guys because you guys matter the most. I'll see you next week.
Nice to meet you, sir. Let's put some.